Hi everyone, my name is Tegan Thomas. For my presentation today I'm going to be talking about celiac disease. So here's just an introduction. There's a little infographic on the right if you'd like to look at it. Celiac disease is a digestive system disorder in which the villi of the small intestine is damaged and obstructs the absorption of nutrients. So the villi of the small intestine are these pillar-like structures that kind of protrude from the small intestine. And in patients with celiac disease, they're flattened, and then they almost kind of end up looking like pancakes. And when this happens, the small intestine isn't able to get those nutrients that it needs. And this is triggered by the consumption of gluten. I'm sure most of us know what gluten is. It's a protein that's found in many foods. Mostly when you think of gluten, you're going to be thinking of things like wheat, rye, barley, any sort of bread, pretty much, things like that. But it's also found in commercial products. There's things like toothpaste and other medical things that have gluten in them. There's a variety of symptoms that we're going to talk about in the next couple of slides. But when you think of celiac disease, you mostly think of stomach and digestive issues. There's also skin conditions that go along with it, and we'll talk about that as well. So here's some background. In this picture on the right here, you can see on the left is the normal villi, where they're like pillars, and they protrude off of the small intestine, and then they're flattened, and that's when they're not able to absorb the nutrients. So the reason why this happens is because the body mounts an immune response against the small intestine after that gluten is ingested. And in this attack by its own body, the villi are damaged, and that results in the flattening and unable to absorb nutrients. So the disease was discovered in the early 1900s. Approximately 2 million people are diagnosed in the United States, and about 1% of the world's population is diagnosed. So a pretty staggering number here, about 83% of Americans that have celiac disease are actually undiagnosed. So this kind of goes hand in hand with the next bullet point about worldwide prevalence being on the rise. So I think this is kind of due to, I think it goes undiagnosed so often because the symptoms can be so common for other things. When you're just talking about stomach problems, so many people, there's so many different conditions that involve stomach aches and things like that, then probably half the time people are just assuming that it's just something that'll just go away. So I think a lot of times that's why it's undiagnosed or even misdiagnosed as other things. And one of the reasons I believe the worldwide prevalence is increasing is because people are starting to get diagnosed properly more, so that number is going to go up. People are realizing it's not just like a stomach ache they might have, they actually have a serious disease. So we'll talk about symptoms here. So kind of the main thing you think about for celiac is digestive issues, as we said. And so the main things that go with that are bloating, diarrhea, constipation, nausea, and any sort of abdominal pain or stomach pains in that region of your body, in the gut. If digestive issues are 1A, 1B is skin conditions. There's multiple different types of rashes that go along with celiac, but kind of the main one we're going to talk about is dermatitis herpetiformis. That affects about 10% of people who have celiac. It doesn't look like anything especially different from any other sort of rash. It's red, bumpy, it's really itchy, and the bumps kind of blister over as time goes on, and it's really uncomfortable for the patient. It can form anywhere on the patient's body, and we'll talk about this more later. But even after a gluten-free diet is started, sometimes the rashes, that dermatitis herpetiformis, will stick around, so other measures will have to be taken to deal with that. And then just some miscellaneous symptoms that kind of go along with so many other things. We have fatigue, headaches, lack of balance, reproductive and fertility issues in women, dry mouth, and canker sores that are like form the inside of your lip if you've ever had one. And then just kind of mental health issues that go along with that. It can be a tough time for a person's life, especially when they first start dealing with it. There's a lot of mental health issues that can go along with that. And then some indirect consequences. The kind of main indirect consequence is malnutrition from not getting those nutrients. And because of that, you have things like enamel in your teeth being damaged. In children, puberty is delayed. Just in general, stunted or slowed growth. Things like uncontrollable weight loss and just emotional mental health issues, like I said, but also mood swings. Talk about some causes here. So celiac disease is primarily a hereditary condition. There's two groups of normal gene variants that cause the disease, and they go by DQ2 and DQ8. So about 30% of the people in the world possess these genes, but out of that 30%, only 3% of them will eventually develop the disease. On the right, you have a photo here of what they call the iceberg. It's three kind of pyramids showing how common each thing is. The bottom pyramid is latent celiac disease, so that's where the villi aren't damaged. And the top two pyramids, the red and blue, are where it's damaged. The red being the villi are damaged, but nothing really comes from it. Celiac disease isn't activated. And then the blue, the smallest pyramid, is actual celiac disease where symptoms are found. There's other genes being studied, but nothing of substance has really been found. But they are studying it, trying to see if they can find any other correlations. And then another thing I wanted to note is that if you have two children, one or if both who have a hereditary disposition, so they had someone in their previous family recently related to them, and if they have the same kind of degree of relation to that person, say if it's both their fathers have celiac disease. The kid who eats a lot more gluten in their youth, so just eating a ton of bread is what I imagine, is going to have a higher risk. I'm not really sure why, but there is a correlation there they have found. So testing is done when there's a reasonable suspicion that celiac disease may be the root of the patient's issues. This is because there's no routine screening, so you kind of have to go through some loops to be able to be tested for it, and I believe that kind of makes sense. It's not something you're going to routinely screen for. You have to go to your doctor, tell them your symptoms, your stomach problems, and a rash if you have one, and they'll take that into account, and they'll probably go through a lot of these different tests that we have listed here. So pretty much with any condition, you're going to start with a physical exam. Your doctor's just going to do an overall checkup of your body. They're going to look at things like how your weight has fluctuated. Just an overall exam, like I said. Then we'll do just listen to your abdomen, see if you have any weird noises, or ask you about pain and anything kind of related to your stomach and your gut microbiome they'll look at. And then to study kind of if you have malnutrition from this, they'll look at your dental exam and your blood tests. Dental exam, you can trace that back to when we talked about the tooth enamel damage. You can also do things like a small intestine biopsy, skin biopsies, and then a genetic test is kind of the end-all be-all. You don't necessarily have to do a genetic test, but they will do some sort of family history test, whether that's just looking through paperwork or actually looking at your genes and seeing if you have a connection. Because you're not, like we'll talk about here on the diagnosis slide, you're not going to be diagnosed on your symptoms alone. You basically have to have some sort of connection found in your family medical history that's going to be used to help diagnose. And then this diagnosis is going to remain with the patient for life. We'll talk about the treatment and cure in the next two slides, but it's not something that goes away. So treatment. Symptoms subside after a gluten-free diet is implemented. As most of us probably know, gluten-free is the reason why the diet was created was to help people with celiac. People who don't have celiac also follow this diet, but it's mainly for people with celiac disease. And we'll talk about kind of what this diet means in the next slide, but it's basically avoiding certain types of foods that have gluten in them. And this is something that has to be strictly adhered to. There's not a lot of room for mess-ups or anything like that because it'll cause your symptoms to flare back up. And then we can also talk about secondary treatments. So like when you treat celiac disease, you're not necessarily treating the like your skin condition. A lot of the times when you start a gluten-free diet, the rash or whatever you have will just go away. But if it doesn't, then there's like certain antibiotics and just skin medications you can take. And then also your doctor's gonna probably give you some nutritional supplements if you lost a lot of weight, or just something to help you get back on track in terms of avoiding that malnutrition. So that can be anything from like a protein powder to some sort of, if it's a small child, some sort of like formula or something to get those calories and nutrients back up. So here we'll talk about the cure. So like I said, there's no cure for celiac. The only thing you can really do is follow a gluten-free diet. There's no vaccine, there's no shot you can take. this is pretty much the best option and the only option. So just this chart is going to talk about just some common things that have gluten in them. So that's pretty much any bread you can think of, any sort of baked goods. So that's cookies, cake, pastries, donuts, anything like that. Pasta, cereal, beer. There's a lot of fruits and vegetables. So these are things that a person with celiac disease is going to have to look at the nutrition label and find out themselves. And then there's gluten-free options, obviously. They have gluten-free alternatives for almost every sort of food. So if you just want to buy regular white bread, you'll just go to the grocery store. In the same bread aisle, there'll be a package that has a big gluten-free stamp on the front. So that's one option, just finding gluten-free alternatives. But there's also foods that don't contain gluten that are safe to eat for people with celiac. So that's things like if you want if you want to have a burrito, you can use a corn tortilla instead of a flour. If you want to have spaghetti, you can use something like a zucchini noodle. For cereals, you have to stick with a corn or rice cereal. That's something like Chex Mix or Rice Mix, or Rice Chex, I'm sorry. And then for alcohol, you can drink red or white wine. And there's also certain types of beers don't have gluten in them, or for certain people, the amount of gluten in them is low enough that you can drink them. So I know Corona is one of them. I'm sure there's a few others, but these are all things that celiac patients research on their own and they kind of have to find out. So current research on the left here is a picture of the TAC062 enzyme. And it's an enzyme that's currently being researched as a possible treatment for celiac disease. It's supposed to be paired along with the gluten-free diet, and it basically kind of attacks the gluten once it's in the person's system, and it's supposed to help out the person with celiac. It's only in phase 2 of its clinical trials, so it's not very far along, and they're testing it it's shown preliminary success, but they're testing it to see if it can deal with higher levels of gluten to help people in those situations. So that's positive. That's something they're working on. Then another thing they're studying is trying to find the correlation between, there's a couple of different diseases that have noticeable change in risk for people who have celiac. So one we'll talk about is autoimmune arthritis, and this is actually present in children and adults. Children with children with celiacs are 3 times as likely to develop the arthritis as opposed to regular kids, and then in adults they're 2 times as likely. And this is kind of attributed to, well, it's not known for sure, but they think it's because just like a change in the gut microbiome, it's easy to get infections, and that can the gut microbiome is super influential on the whole body. And then the other reason was, we'll come back to it. The heart disease also there is, I believe the statistics said there was 9 out of 1,000 people who have celiacs are developing heart disease, and then people without celiacs, it was like 7.4 out of 1,000. So they don't really know why the risk is there, but they do know it's there, and that's something they're studying. And then also, there's constant research being done regarding new ways to produce more gluten-free foods, and that's anything from just like making gluten-free foods taste better to just new ways to process it and anything like that. So that's always something we're researching. Oh yeah, and then for arthritis, I'll come back to this. The reason why they thought they might be connected is just like a shared genetic disposition. They share a lot of the same genetic traits, these 2 diseases, so arthritis and celiac, so that's something that they're studying as well. And that's all I have. Here's my works cited and medical terminology. Thank you.